LPN NCLEX practice exam, the ultimate roadmap to passing. Question 1. An African American female comes to the clinic. The physician suspects vitamin B12 deficiency anemia. Because jaundice is often a clinical manifestation, what body part would be the best indicator? Option A, conjunctiva of the eye. Option B, soles of the feet. Option C, roof of the mouth. Option D, shins. The correct answer is option C, roof of the mouth. In heavily pigmented individuals, the hard palate, roof of the mouth, and the sclera of the eyes are the most reliable locations to observe the yellow discoloration of jaundice. Question 2. The nurse is conducting an admission assessment of a client with vitamin B12 deficiency. Which of the following would the nurse include in the physical assessment? Option A, palpate the spleen. Option B, take the blood pressure. Option C, examine the feet for petechiae. Option D, examine the tongue. The correct answer is option D, examine the tongue. A classic, definitive physical finding of severe vitamin B12 deficiency, pernicious anemia, is a smooth, thick, beefy red, and painful tongue, glossitis. Question 3. Clients with sickle cell anemia are taught to avoid activities that cause hypoxia and hypoxemia. Which of the following activities would the nurse recommend? Option A, a family vacation in the Rocky Mountains. Option B, chaperoning the local boys' club on a snow skiing trip. Option C, traveling by airplane for business trips. Option D, a bus trip to the Museum of Natural History. The correct answer is option D, a bus trip to the Museum of Natural History. A low-stress bus trip avoids high altitudes, extreme cold, and unpressurized cabins, all of which are severe triggers that cause red blood cells to sickle. Question 4. The nurse is instructing a client with iron deficiency anemia. Which of the following meal plans would the nurse expect the client to select? Option A, roast beef, gelatin salad, green beans, and peach pie. Option B, chicken salad sandwich, coleslaw, French fries, ice cream. Option C, egg salad on wheat bread, carrot sticks, lettuce salad, raisin pie. Option D, pork chop, creamed potatoes, corn, and coconut cake. The correct answer is option C, egg salad on wheat bread, carrot sticks, lettuce salad, raisin pie. Eggs, whole wheat bread, dark leafy lettuce, and raisins are all exceptionally excellent dietary sources of natural iron. Question 5. A newly admitted client has sickle cell crisis and is complaining of severe pain in his feet and hands. The pulse oximetry is 92. Which intervention is implemented first? Option A, adjust the room temperature. Option B, give a bolus of intravenous fluids. Option C, start oxygen. Option D, administer meperidine 75 mg intravenous push. The correct answer is option C, start oxygen. Sickling is directly caused by a lack of oxygen. Applying supplemental oxygen immediately reverses hypoxia and stops further cells from sickling. Question 6. Which of the following foods would the nurse encourage the client in sickle cell crisis to eat? Option A, peaches. Option B, cottage cheese. Option C, popsicle. Option D, lima beans. The correct answer is option C, popsicle. Dehydration rapidly accelerates the sickling of red blood cells. A popsicle provides an easy, highly palatable source of immediate fluid hydration. Question 7. A 25-year-old male is admitted in sickle cell crisis. Which of the following interventions would be of highest priority for this client? Option A, take hourly blood pressures with mechanical cuff. Option B, encourage fluid intake of at least 200 milliliters per hour. Option C, position in high Fowlers with knee gap raised. Option D, administering Tylenol as ordered. The correct answer is option B, encourage fluid intake of at least 200 milliliters per hour. Massive intravenous and oral fluid hydration hemodilutes the blood, physically washing out the sticky, sickled cells that are clogging the capillaries. Question 8. A 30-year-old male is brought to the emergency department in sickle cell crisis. What is the best position for this client? Option A, side lying with knees flexed. Option B, knee chest. Option C, high fowlers with knees flexed. Option D, semi-fowlers with legs extended on the bed. The correct answer is option D, semi-fowlers with legs extended on the bed. Keeping the legs fully extended promotes maximal venous return and arterial blood flow. Flexing the knees cuts off circulation and worsens the painful ischemic crisis. Question 9. A 43-year-old African American male is admitted with sickle cell anemia. The nurse plans to assess circulation in the lower extremities. Which outcome criteria would the nurse use? Option A, body temperature of 99 degrees Fahrenheit or less. Option B, toes moved in active range of motion. Option C, sensation reported when soles of feet are touched. Option D, capillary refill of less than 3 seconds. The correct answer is option D, capillary refill of less than 3 seconds. Capillary refill is the gold standard, objective measurement of how well arterial blood is successfully perfusing the distal tissues. Question 10. The client with a history of diabetes insipidus is admitted with polyuria, polydipsia, and mental confusion. The priority intervention of this client is: Option A, measure the urinary output. Option B, check the vital signs. Option C, encourage increased fluid intake. Option D, weigh the client. The correct answer is option B, check the vital signs. Diabetes insipidus causes massive, rapid fluid loss. Checking vital signs immediately identifies if the patient has crashed into deadly hypovolemic shock. Question 11. A client with a pituitary tumor has had a transsphenoidal hypophysectomy. Which of the following interventions would be appropriate for this client? Option A, place the client in Trendelenburg position for postural drainage. Option B, encourage coughing and deep breathing every 2 hours. Option C, elevate the head of the bed 30 degrees. Option D, encourage the Valsalva maneuver for bowel movements. The correct answer is option C, elevate the head of the bed 30 degrees. The surgery breaches the floor of the skull. Elevating the head of the bed decreases intracranial pressure and strictly prevents cerebrospinal fluid from leaking out the nose. Question 12. The home health nurse is visiting a client with autoimmune thrombocytopenic purpura. The client's platelet count currently is 80,000. It is most important to teach about: Option A, bleeding precautions. Option B, prevention of falls. Option C, oxygen therapy. Option D, conservation of energy. The correct answer is option A, bleeding precautions. Idiopathic thrombocytopenic purpura marks the destruction of platelets. The patient must adhere to strict bleeding precautions to prevent fatal internal hemorrhages. Question 13. A client has autoimmune thrombocytopenic purpura. To determine the client's response to treatment, the nurse would monitor: Option A, platelet count. Option B, white blood cell count. Option C, potassium level. Option D, partial prothrombin time. The correct answer is option A, platelet count. Because the disease fundamentally destroys platelets, tracking the absolute platelet count is the only direct way to evaluate if immunosuppressive therapy is working. Question 14. A 21-year-old male with Hodgkin's lymphoma is to begin radiation. He is engaged to be married. Which of the following would be a priority for this client? Option A, sexual dysfunction related to radiation therapy. Option B, anticipatory grieving related to terminal illness. Option C, tissue integrity related to prolonged bed rest. Option D, fatigue related to chemotherapy. The correct answer is option A, sexual dysfunction related to radiation therapy. Pelvic radiation destroys rapidly dividing sperm cells. Fertility preservation and sexual function are absolute top priorities for a young, engaged male.